This is a procedure demonstration of the PM2 system and Nav Stylet for navigation and bedside tip confirmation of peripherally inserted central catheters. The PM2 system is FDA cleared as an alternative to chest X-ray, and the Stylet is compatible with any PIC 3 French or larger. To begin the procedure setup, we first attach the provided sterile screen cover to the PM2 system so we can interact with it while remaining sterile. The PM2 system comes preloaded with the GE vScan Air app and is fully compatible with the vScan Air wireless ultrasound probe. Here, we have a right arm basilic vein insertion, and at this point in the procedure, the vascular access specialist has already set up the sterile field and draped the patient, and is performing final vein assessment using the vScan Air app on the PM2 system monitor. Once access to the vein is achieved, we can easily switch from the ultrasound back to the Piccolo app on the single integrated display. We are now ready to perform our final catheter preparation. So far, there has been no change to our standard workflow. First, we remove the PIC and cut it to length. The lumens are then primed. Next, we load the Stylet into the PIC. The Stylet includes an atraumatic guiding tip, which needs to be adjusted at the catheter hub until the guiding tip extends approximately 1.5 centimeters from the end of the PIC. At this point, we are ready to fill the syringe with a 5% dextrose solution, used to activate the blood flow sensors on board the Stylet. We take care to remove the air from the syringe, then connect the syringe to the provided tubing set, and load the syringe into the sterile pump. This system is now pressurized and ready to go. We connect the tubing set to the Stylet to begin the infusion of dextrose. Once we see drops forming on the tip of the Stylet, we are ready to make our electrical connection from the Stylet to the system, which is done without compromising the sterile field. We are now connected and ready to begin our insertion. In all, the setup of components specific to the navigation Stylet takes approximately 90 seconds, which saves the user a significant amount of time compared to waiting for chest X-ray confirmation after a similar procedure done without the navigation Stylet. We are now ready to begin navigating to the cavo-atrial junction with the PM2 system. Navigation and tip confirmation with the PM2 system is simple. The first step is to select the Begin PIC Case button to start the procedure. Next, select your insertion site used for vascular access. The Piccolo app will now show you your external and intravascular ECG on the left, as well as the anatomy mode view on the right for real-time PIC tip navigation. We can switch at any time between this view and a full screen anatomy mode view. If we prefer to see the live ECG, we can return to ECG mode at any time. Accidental turns up the internal jugular vein can be immediately detected by the blood flow sensors and shown on the anatomy view. Similarly, you can see in real time when you have pulled back into the peripheral vein. The algorithm also detects changes in the P wave to determine when the catheter has entered the SVC and uses both the blood flow sensors and P wave to determine when the catheter has advanced too far into the right atrium, or when it is properly positioned at the CAJ. Final confirmation of PIC tip position is achieved by reviewing the intravascular ECG signal and documenting the maximum P wave with no negative deflection with a screen capture. We can also record case notes for the patient and document the final catheter cut length for this procedure. The PM2 system provides an NCASE checklist to ensure all best practices for bedside confirmation are utilized. In the File Manager, you can view all of your previous cases and their associated screenshots, case notes, and procedure reports. To generate a procedure report, select a case, mark your final placement screenshot, and select up to 3 screenshots to include in the procedure report. This report can be wirelessly printed and transferred to the patient's medical record. Thank you for watching this demonstration of the PM2 system.